This case here presented to the clinic with the chief complaint that they were self-conscious about their smile because when they smiled broadly, the retainers of their existing metal denture were visible on the sides. That would look something like this, you can see here. Now what we've done is we've designed a flexible partial Valplast denture for this particular case, which fits nicely on the model. There's a very nice rotational path of insertion, as you can see here for any prosthetists or any professionals watching. For everyone else, that is what I like to call a trick to the denture, and I say that every denture's got a trick, which is the way that it goes in and comes out again. This one clicks in nicely, and all of these cases, the patient will be much better at knowing the tricks to how to remove and place their denture in just a very short period of time. Valplast flexible partial dentures are designed with the clasps that go over the teeth and over the gums a little bit as well. They are not invisible, but they are certainly less visible than metallic clasps, which tend to look a little bit like jewelry in the mouth as they catch the light and reflect anything that's shiny. With this particular case, it was prominent because of the way that these posterior teeth have erupted over time, and you can see on the arch there, it kind of looks like the teeth fall back. There's not a nice flat plane. It goes flat at the front and then it falls off towards the rear. And that meant that those clasps were hanging down quite a bit on either side of the mouth there. The reason for that is because of what's going on the lower jaw. I've highlighted the posterior denture teeth in black here, so everything that's not painted black is natural teeth. And what's happening on the lower jaw is that this lower denture was not replaced when it should have been. That means that as those lower denture teeth have worn down over time, they have caused the top teeth to follow the same kind of pattern. So the lower natural teeth go flat and then they fall down, they're scalloped out, which happens to all dentures over time. But when the lower denture is not replaced when it should be, the natural teeth will want to naturally fall into that space that's been created. That's exactly what you can see here. In this case, that's made this whole situation a whole lot worse and made it a whole lot more noticeable for this patient to be able to see those metal retainers like that there in the mouth when they smile. Our solution here is a gum-colored retainer that fits nicely over the teeth here and a little bit over the gum as well. When this person smiles, those retainers are going to be almost invisible. This is a fantastic option for patients that desire a more aesthetic prosthetic appliance. It's one of many options available, and I'm not saying by any means that Valplast is the best material that there ever is or ever was. There's many options, and there's many scenarios. There's no one size fits all case for everybody. Every person has individual needs, individual requirements, and individual limitations based upon the anatomy of their mouth and their current situation. I hope this information was useful for somebody out there. Thanks for your time. I'll see you all in the next one. Bye, everybody.